We are back with Dr. Muller from Red Bank Veterinary Hospital discussing the clinical uses of the CRP biomarker. Earlier, we discussed the value in using CRP as a veterinary diagnostic tool to aid in clinical decisions and a patient's response to treatment. Dr. Muller, could you give us some real-life cases where the biomarker CRP could be used?
Of course. We can review a case of Lucy. This is a case of suspect pancreatitis and where CRP can be really useful. Lucy is an 8-year-old female spayed Shih Tzu that was presented to the hospital for a 2 to 3 day history of vomiting and diarrhea. The owners do admit that they did give some of their leftover food a couple of days ago, and since then she's been very lethargic. You note on your physical examination that she had some cranial abdominal pain, and on your initial diagnostics you note an elevated amylase and lipase. Based on these findings, you suspect pancreatitis.
Was CRP included at the initial diagnostic evaluation, and if so, what for?
Because CRP is a non-specific inflammatory marker, it's useful in cases such as this to determine the severity of the disease as well as disease tracking. In this case, CRP was used as a diagnostic tool to determine the severity of disease. With Lucy, with the information provided you thus far, it's hard to determine if this is a case of acute mild pancreatitis versus severe necrotizing pancreatitis. Currently, the modality that's used to differentiate between the two is an abdominal ultrasound, which is not readily available for most clinicians. With CRP, one is able to assess the level of inflammation and in this case determine the severity of the disease. In cases with acute pancreatitis versus necrotizing pancreatitis, it has been reported that the CRP elevation is 3 times that higher in necrotizing pancreatitis as compared to acute pancreatitis. Thus, the use of CRP would help identify cases that require prolonged hospitalization versus simple medical management for acute and mild pancreatitis.
So in this case, it can be used to help clinicians determine treatment options by helping the clinician determine the severity of the disease. It leads to a quick and efficient determination of the patient's condition and an individualized treatment plan. Are there any other uses or cases where it is helpful?
Actually, in this case, it not only helps to determine the severity of the disease, but also treatment tracking throughout the disease process. Reports have noted a decrease of the CRP concentration at day 3 to 4 of hospitalization for those patients that recovered fully versus those that did not with severe pancreatitis. Thus, CRP can be a cost-effective tool to allow you to determine disease severity as well as treatment tracking. This ultimately provides a critical prognostic indicator for response to therapy.
To recap, general practitioners can use CRP in particular cases, as the ones you mentioned, to evaluate the severity of the disease and to choose the appropriate treatment, but also to assess response to therapy and have a more precise insight of the prognosis. Any other cases where CRP can be used as a tracking tool to evaluate response to therapy?
Of course. There are many cases where CRP can be utilized. One can consider using CRP in any disease process that has a high level of inflammation. For instance, osteoarthritis is a disease where inflammation drives the progression of the disease and results in clinical signs such as pain, stiffness after rest, and decreased mobility. Let's look at Thor. He's an 11-year-old male-neutered German Shepherd. He was presented to hospital for pain and stiffness after rest. Hip radiographs revealed severe osteophytosis in the coxofemoral joint, or bone spurs, and he was diagnosed with osteoarthritis. Osteoarthritis is an unfortunately debilitating disease. Current treatment plans is a multimodal approach that includes weight loss for those with overweight patients, rehabilitation, analgesics, and nutraceuticals. The aim of treatment is to decrease systemic inflammation involved with osteoarthritis. This leads to improved mobility and decrease in pain.
So CRP can be used to evaluate treatment efficacy?
Yes. Traditionally, patients' response to treatment has been through client assessments or veterinary assessments, which are variable between veterinarians and biased between clients. We can use CRP as an objective measure to track a patient's initial CRP concentration and then track it over time. We can track CRP to assess the overall inflammatory state within the body, indicating response to treatment. CRP is a real-time marker of inflammation within the body, as it changes very quickly, and one can use it to track response to treatment over time. A decrease in CRP would indicate a good response to treatment, whereas an increase in CRP would indicate a failure of treatment and in some cases a progression of disease.
So you were saying that CRP can help eliminate a lot of the ambiguity associated with pain evaluation in an OA. Is there anything else CRP can tell us about treatment efficacy?
Yes. It has been found that CRP is a predictor of disease progression within osteoarthritis. So an increase in CRP is positively correlated with increased cartilage loss in osteoarthritis. Therefore, by focusing treatment on reducing the inflammatory component within the body, one is able to decrease the progression of the disease as well as decrease the pain associated with osteoarthritis.
So the use of the CRP test can be an objective way to track the progression of the disease and can help us focus our treatment efforts on the specific inflammatory issues associated with OA and more effectively treat the patient.
That's right. CRP is an untapped resource for clinicians, and we're only beginning to see its potential.
Dr. Muller, thank you so much for your time. This has been very helpful and enlightening.
Thank you for having me.